Hi, this is Julia from Denver Mobility, and today we're going to talk about foam rolling for your IT bands. So IT just stands for iliotibial. It goes from kind of the top of your hip up here all the way down, attaching to your tibia on the bottom. It is pretty small and very fibrous. It helps a lot with lateral motion and agility. It's also kind of a tough place to stretch. So you need a little bit of tension in your IT bands in order to stabilize your hips and be able to move side to side. So I'm going to show you how to lengthen your IT bands from the side instead of just rolling up and down and lengthening them long ways. Okay, so all you're going to need is a foam roller. It can be a long one or a short one. This one's pretty dense. Sometimes this is a little rough for people, so if you need to start with one that's slightly softer, that's okay. It might also be easier to start with one that's smooth before you go to one that's got the little bumps in it as well. But you're just going to put down the foam roller and start somewhere along your AT band. I usually start high and work my way down. You're going to get on this and go straight out from your hip. So this leg should be straight. If it hurts a lot, you can put your top leg over. If it's not too bad, I usually just stack both of my legs on top of each other. But no matter which way you'd like to do it, what you're going to do is find a spot that does not feel very comfortable because it's probably tight, and then you're going to slowly pull your heel straight back towards your glute, almost like a hamstring curl, and slowly come back out. So you can do this a couple times, or you can move this down, maybe find a different spot, and do the same thing of just bending slowly and straightening. Sometimes I'll even kind of lean my hips forward a little bit. That's really tight. And just roll kind of from my hip. It's like rotating your femur and your hip, rolling back and forth this way. And again, that's going to help lengthen this way and unstick. Sometimes your IT band gets stuck to your quad, or on the other side it gets stuck to your hamstring. So you're breaking up adhesions and giving it a little bit more space to move. If you lengthen it too much long ways by just rolling up and down, it might actually get tighter because it's trying to stabilize your hips and it's too long. So this is a good way to help potential knee pain, especially low. Also even hip pain and back pain as well if the IT bands